let's talk about cranial nerve 1, the olfactory nerve. As you all know, it has only the sensory function or the special sensory function, and it carries smell. So the pathway of olfactory nerve is usually not asked in the exams. However, for brief review, the sense of smell is perceived by the receptors which is present in the nasal epithelium. These are known as the olfactory receptors, the axons of which it's nothing but the olfactory nerve. It passes through the foramen in the cribriform plate of ethmoid bone to reach the cranial cavity, and then it passes to the olfactory bulb, which is located in the olfactory groove. Here it synapses with the specialized cells, which is known as the mitral cells, and then it continues at the olfactory tract. The olfactory tract projects posteriorly, and when it reaches the anterior perforated substance, it divides into two striae, which are known as the lateral striae and medial striae. The lateral striae carries axons primarily to the primary olfactory cortex, which is located in the temporal lobe, whereas the medial striae, it carries axons across the medial plane of the anterior commissure, and it usually projects to the opposite olfactory bulb. Next, how do you examine cranial nerve 1 or the olfactory nerve? So initially, instruct the patient clearly. First, examine each nostrils separately, and then ask the patient to close eyes, or close patient's eyes. One nostril also needs to be occluded, and whatever the substance which you're going to examine needs to be brought near the nostril which is being examined, and then patient is asked to sniff. If the patient can smell something, ask him to tell what exactly is the substance and what is he able to smell. If not, it means that it is abnormal and possibly patient has anosmia. And then test the opposite side or the opposite nostril next time. What are the usual test substances used for testing cranial nerve 1? So you need to use something non-irritative or non-volatile like coffee, clove oil, wintergreen, cinnamon. These are the things which are usually used. And don't use volatile substance like ammonia. Important diseases or conditions which affects the cranial nerve 1. So temporary loss of smell is very common and commonly seen, like I think each one of us would have experienced, and that's commonly seen with upper respiratory tract infection. Most common causes of anosmia or loss of smell or hyposmia are craniocervical traumas, nasal and sinus diseases, and most commonly idiopathic, and we do not know the exact reason for it. There are some of the neurological diseases which can result in reduced smell or hyposmia. So one of which is olfactory groove meningioma or sphenoid ridge meningiomas or any other tumors, glioma of the frontal lobe. And very, very importantly, some of the neurodegenerative diseases can initially have reduced smell. Initially starts with hyposmia and anosmia. And one of the most common causes like Parkinson's disease.